Hey, everybody. Before I get started, I'm just going to double check that the audio is working. It seems like you guys can see me okay, which is great. So I'm just going to double check that the audio is working, and then we will get started. And I'll tell you guys all the things I have heard from all my company partners and travelers on the front line, and share with my community all the changes that are happening every day. So you guys, let me know if you can hear me, yes or no. And if you can't, then I'll do a little bit of tech support and then I'll come back. You guys can hear. Awesome. Well, thank you guys for joining me. And let me know how you guys are doing. This is going to be live. It'll probably be about 15 minutes of chatting, 20 minutes of chatting about what I'm seeing.
Then I'll do a little bit of tech support.
But how are you guys doing? Who's joining? Are you guys recruiters or companies? Are you guys travelers or healthcare workers? Where are you at? And just tell everyone in the comments what's going on in your world. Are you working? Are you canceled? How's the PPE in your hospital? How are you feeling? I'd love to hear from you guys to hear what's going on. So, all right, let's dive in. Let's dive into the industry. So I'm going to start out by talking about the resources at the beginning of this for you guys who are joining right now. So and you guys will see me the whole time. And then as we're going, I'm just going to put a slide up. This is what I'm talking about. So later, whenever you're watching this, you can kind of scroll and see the topic you want to hear about. So resources that are going on in the Nomadicare world that I want to share with all of you guys. We have been working around the clock at Nomadicare with our company partners, with the travelers that use us as a resource, with hospital systems, really trying to see what can I do to help as this is going on. And so I want to let you guys know what's available to you today at Nomadicare that was not available a week ago. And there's three things. One, there is a job board that is specifically for crisis rates. And the reason this job board is so special is because this is going to be a job board that dozens of companies are going to be putting their crisis rates on. So we'll have a spot that has a collective amount of jobs on it that's specific to this COVID-19 crisis. It does not mean all the jobs on there have a confirmed person that has COVID-19, but a lot of hospitals are prepping all around the country. And so it's just the ones that have the increased bill rate and the higher pay packages. So they're going on there. And then starting next week, you're going to start seeing little icons pop up. So a bunch of these companies have agreed to become rapid response agencies. And this is something we have not seen in our industry yet. And what I'm really excited about is that companies are saying yes and coming together and agreeing to take one profile for you guys to be able to submit through many companies instead of having to do paperwork over and over again. So there might be little things you have to do to get submitted, but by and large, if you have a skills checklist, your work history, your references, your credentials, you'll upload them one time and you can submit through all of these different agencies that will have the icon next to the name. And so that means that they're a rapid response agency. And the way that you become on the rapid response team is you are going to be filling out the very beginning, the submittal ready part of the profile on Kamana. Kamana is who Nomadicare is partnered with to help bring this to the industry. And so you'll fill that out. And so then you will become part of the rapid response team, which means as you get sent over to these crisis jobs you're interested in, you'll come with a link, and that will be your link to submit. Now, it doesn't mean if you just connect and say you're interested, they're going to submit you right away. They won't. They'll talk to you first. You'll still have the say if you get submitted, but it just speeds things up a ton. So I'm going to show you where you're going to start going. So already there's jobs filling up on this job board, but over each new day, and especially next week, you're going to see this really get filled up with jobs. And so this is how you find this. First, this is the homepage. If you guys have ever been to nomadicare.com, this is the homepage. This is where you go when you're looking for that custom recruiter match, or you're looking for jobs, or our blog, or our fair pay calculator, anything. This is where you go. You can see in the top right-hand corner that there's a button to say see all jobs, or now we have a red banner that's there where you can click to just see the quarantine jobs. And so when you click on that, it'll take you to a page that's our job board page. So on this job board that we already have, you can click and find your specialty and see all the jobs already that are out there for dozens of companies. But when you click on the red line, it'll just show you the crisis rate jobs, the high paying jobs. And so you can click on that. And that's how it'll show you like the really high paying jobs, and every single bit of detail that we have, we're going to show to you. And when you instantly match with these jobs starting next week, you could be part of the rapid response team. And these will start having icons on them if it's an agency that's part of a rapid response agency. So we're really excited for that. So if any of you guys are not part of the rapid response group yet that's interested, I would be honored for you guys to join us. I'll share a link right now in the comments. So if anyone wants to sign up to get information with this when this launches, that is the link to do it. And if there's any agencies that are watching right now, you guys are so welcome to be a part of this too. We have an expedited way that you can come through Nomadicare and make sure that you're a good fit for Nomadicare. But after that, we are encouraging as many agencies as you want to be part of the rapid response agencies. So please just feel free to email me. I'll put my email down here too. You guys are welcome to be a part of it. This is a time for us all to come together. So those are resources. Now let's just talk about trends and what we are seeing right now. So I'm going to start out by talking about where is the biggest demand that we're seeing changes. And so the biggest thing that we're seeing right now is ICU nurses, ER nurses, labor and delivery nurses, and telemetry nurses have an increased demand, and they're the ones that are getting most of the crisis rates right now. We also, of course, are seeing a huge increase in respiratory therapists that we have a demand, and SLPs, speech language pathologists, are still just like really in need right now. We have not seen that go down like we have with the physical therapist or the occupational therapist. So those are the specialties as of today that we're seeing actually an increase of what the needs are. And then the locations, we're seeing an increase in locations with needs. The ones that we're seeing the highest pay are going to be probably the ones you expect. California has a lot of crisis rates. Massachusetts has a lot. And Washington has a lot. Those are our 3 top highest paying ones right now. But then there's a lot more that just have a ton of job openings, but we're not necessarily seeing huge increases in bill rates on all the jobs right now. But places like Florida and Colorado have a ton of needs, and Texas and Virginia have a ton of needs too, and openings that are unusual. But we're not seeing the crisis pay there like we are in some of the other places yet. It could be coming. Then let's talk about outpatient clinics and operating room needs. So you guys have probably seen on news at the very least that a lot of elective surgeries are getting canceled. Some of them are mandated by the governors of the state saying you're not even allowed to. Actually, fun fact, my mom was the very last person to get an elective surgery in her area. She got a knee replacement. But then they stopped doing it right after her. So she woke up from surgery and they're like, you're the last person. But these are closing like crazy. So what we're seeing is a drop in the needs for OR nurses. And we're also seeing as state by state or city by city where we're having the stay in place orders, that is when we start seeing the outpatient clinics actually close. And so when we look at physical therapists, operating room nurses or techs, and occupational therapists, we're seeing those be the highest reasons that they're getting cancellations. So we have seen an increase in cancellations specifically with outpatient clinics and of course with schools. And I think that's it for that one. So, but we'll talk about the schools. So right now we have hundreds of different speech language pathologists and occupational therapists displaced from schools. Schools, of course, have closed down for a while, I think pretty much everywhere. But the contracts are not necessarily getting canceled. I think agencies are doing a tremendous job, by and large, in our industry of trying really hard to care for us travelers and pay us while we are in these limbo states, while we're getting quarantined. Way more than 50%, probably at least 75% of the agencies are being very generous in paying for our quarantines. And the reason I say generous is not because they shouldn't, like 100% that's what they should be doing. That's because not every facility or school or hospital is necessarily paying them for that. So it's a scary time for them too. Oh, Judy said that she lost me. So if anybody else has lost me, let me know. Or if it's come back, let me know. I'll keep going for now, but then if more people start saying that they lost me, then I'll figure out what to do. Okay, but all these people are getting displaced from their schools. So what we're seeing is people putting these contracts on hold for 2 weeks or 4 weeks. And then, like, fingers crossed, they're hoping that they come back into the schools, or cancellations. Now, in the SLP world, there's actually still a lot of job needs. And so a lot of these agencies that are heavy in school settings are just trying to find new jobs for the SLPs. The OTs is a little bit trickier. We've seen a decrease in OT jobs, period. Before the COVID-19 crisis, we've seen a decrease in the OT orders. And now OTs are decreasing a little bit, but big picture from like a year ago, they're still really hard to find jobs. And the other thing that they're saying, though, is for the OTs and the PTs specifically, and even other specialties out there that are having a decrease in demand, what they're looking at is in the coming weeks, will there be a demand for healthcare workers who are willing to do things like swab tests or take temperatures at airports or take temperatures at the start of hospitals, things like that. People are looking to see, who are we supposed to hire for these positions? Who do we put orders in? So you might see some jobs, some unique job opportunities open up on that crisis job board we have on Nomadicare.com in the coming weeks, because as some of our agency partners get those needs, we're going to be displaying those to you guys, so you guys have a centralized place to see what opportunities are out there to help if your heart is called to go to the front line, but you are someone who might be an OT or a PT where you're not quite sure where you fit into this equation. So I'll just keep you posted as we see those needs pop up. All right. Interviewing for the COVID-19 jobs are a little bit different than our normal interviewing. So one thing just to keep in mind is that a lot of these hospitals are just hiring based on resume. And so that means two things. One, if you really want to get looked at and you really want to get noticed, make sure that profile of yours is really highlighting the skill sets these hiring managers are going to want to see. You're no longer going to get to do your personality or your charm on the phone interviews. They're just going to be looking at that written word of who is the best person to hire. And so make sure your profiles look good, and just be aware you are not going to probably have a phone interview with quite a few of these things. It's just resume to hire. And so if you're submitting your resume, you might need to say yes or no without actually having a phone call. It's just something to know is coming. And then how do you get the highest paying crisis rates? There are rates that we see out there that are $4,000 and plus a week, $5,000 an hour plus a week. And I'm going to tell you the biggest trick to getting these high paying crisis rates is luck. These are the rates that are closing instantly. I've literally talked to recruiters and agencies who said, as soon as a job opened up on their dashboard, they already had people in mind that had given them permission to submit as soon as a high-paying job opened up, and they would submit within 60 seconds, and it would already be closed. These really, really high-paying crisis rates are not easy to get into. I think it kind of is luck of what resume got to the top of the desk, who did they pick? And so these are really hard at this point to get into. Everyone wants them. It's a great pay. It's exciting to see. But it's good to know that. So as you are scanning through the Facebook groups and job boards and stuff like that, you see these ones that are really high. These are, at this point, are going to be the new kind of bait and switch not really, they're not intentional bait and switch. No one's trying to trick you, but the new way that people are going to put up the best sounding ones. So you'll reach out to their agency when most likely that job is already going to be filled really quickly. And so these are not easy to get into, but there's a tier below that that's still much higher than you were used to be paying, but they're not those really exciting $5,000 plus. And those are the ones that are going to be easier to get into. So you might just, if you're really looking for a job right now, you might just do like as you always do. As a traveler in healthcare, options are our best thing. So just submit to quite a few that you want. But if you are looking for like, I just want these really high ones, you're going to want to do the strategy where you find your one recruiter, your one company that you're giving permission before you hear about it to submit you quickly, because these are going to just need speed, speed, speed. It also means having your profile completely ready at whichever companies you're picking so they can submit you right away. They're not waiting for you to hear about it to start getting your paperwork or calling your references. That stuff should be done where they can just submit you as soon as it opens up, as long as they know your criteria for these super high paying ones. And the rapid response agencies, we talked about that with the resources earlier, but that's another way to have more options while you're looking for how do I get to where there's a need, how do I get to the best paying ones. It's going to be for you to become a rapid response healthcare worker where you already have that one profile set up where you can submit to all of the companies who are agreeing to be a rapid response agency to take that profile during this crisis. That is a great way for you to get access to a lot more companies without filling out a million more profiles, which no matter crisis or not, it's the worst. It's the worst to do that. All right, next thing, what do you do if you get quarantined at work? This is a big topic right now all over social media, is this quarantine pay protection. What do you do if you have to get quarantined while you're working? And of course, with everything going on with PPE, it feels like it's not an unlikely scenario if we don't have good protection that we might end up with symptoms and have to be quarantined ourselves. And so with that, we want to feel like our agencies are going to have our back and we're not going to suddenly be without pay because we have put ourselves into these situations to help save lives, to help be there for these hospitals that need us. And so what do? First of all, start the conversation now. If you don't know if your company is going to give you pay protection during a quarantine, ask them and ask them for the specifics. What kind of documentation will they ask for? How long will the quarantine work? Are you going to get your taxable hourly rate and the stipends while you're quarantined? Ask for any details so there's no surprises. Do it before the situation comes up. Do it before you agree to work with a company when you're going to these crisis places, or do it before you go anywhere. This is going to hit every single state and probably every single hospital. Then what do? So most of the documentation that companies are saying is they're saying we will pay for your quarantine if it's required. What that means is you can't just decide for yourself that you have a cough that morning and that you need to go on quarantine. Your bosses, your managers, whoever's in charge at your facility has to mandate that you're getting quarantined or you have no choice. And so you'll probably want to get that in writing, documentation that you can show to your agency that, yes, they're requiring me to be quarantined and this is for how long. So you can't choose that for yourself. And then, if you get quarantined, just hopefully you're with a company that will still pay out those stipends and that taxable rate. Just like with the schools, there's some facilities and hospitals that are still paying the agencies while you're gone, and there's some that aren't. But what we want is an agency that's going to pay us regardless of what the hospital is doing, because that is the right thing to do. And then what do if your contract gets canceled? And so a lot of people were like, well, sure, my agency said that they would pay if I get quarantined and it was mandated, but what if my contract just gets canceled because of low census? And this is going to happen more and more. And this is such an unprecedented thing that's going on. I'm not sure what the contracts say on like the between the agency and the schools or the hospitals on like, what if it's an act of God? This is such a interesting out of everyone's hand thing. I don't know what those languages say exactly, but what I'm telling the travelers is this is something that is probably just refer back to your original contract. Do you have a 2-week notice clause? Do you have a 30-day clause? Just like if you are working a travel assignment, there's plenty of travel assignments where censuses drop and we might get canceled because of that. It has nothing to do with any kind of pandemic or crisis. And when those things happen, your contract usually has something in place that says, well, yes, you're a contract worker. Yes, you can get canceled. But in this contract, you have a 2-week notice. And so that means they would tell you and you have 2 weeks to work it out. So you have some time to get paid and find a new contract. And so if your contract's getting canceled, I would refer to that original contract that you signed to see what is that policy. But I say that, but also, just like I said with the quarantine thing, don't wait for it to happen to talk to your companies and your recruiters. Call your recruiter and ask them today. And of course, get it in writing. What will happen if your contract gets canceled because of the coronavirus, and find out. The best thing we can always do is just figure out expectations up front so there's no surprises when these things happen. All right. And then the last thing I want to talk about is tips during uncertainty. And so this is a really scary time. When I talk to a lot of my travelers in the Empowered group, when I talk to a lot of my traveler friends one-on-one, when I talk to the recruiters, especially in therapy world, and they see contracts getting canceled and they see or job orders cut in half overnight, it kind of feels scary. Uncertainty can feel really scary. And I know us as travelers, like uncertainty is just part of what we sign up for. And over a while, you kind of build a muscle for being like, I can trust that things are going to work out. But it is a scary time. And I think the biggest tips I can give you is everyone is saying this is going to pass. Now, probably it will be a few months until it passes. But on the other side of that, if you are in therapy, if you are an operating room nurse, if you are an ultrasound technician, some of these specialties that might have a decrease in demand for a little while, you're not going away. That demand is going to come right back. Just because people are not getting elective surgeries for a few months while we're dealing with this crisis, they're going to need it as soon as it's back. And they're going to need us to come back in and work these healthcare systems. So this isn't forever. The travel healthcare industry has a long history of going up and going down and feeling like it's almost zero and then skyrocketing. And so we always bounce back. And a lot of times we bounce back stronger than before. So just kind of do the best you can to take those deep breaths and ride the wave, knowing on the other side of this, you're a healthcare worker and you're so important and you're so needed, and it's going to be okay. And for those of you who are going out there into the uncertainty of what PPE is going to be at a hospital, you're raising your hand to be on the front line. I just want to say thank you so much for having a heart to show up like that. That is huge. And those needs are going to go up and up and up in the coming weeks. And I hope all of us as a community come together to support you guys that are working on the front lines in that scariness. And I will keep doing everything I can think of to try to be here to support you guys during that too. And then I would say, what do you do if you're in a situation like PTs where it's suddenly there's not needs or the job demand is dropping? And that might be where you try to stay more in place. There's travel's getting harder across the country. So if you are home right now, you might look at PRN jobs or a different way to get through the next 3 months versus trying to travel all the way across the country to a travel PT job or OT job that might cancel you, especially if it's outpatient or something like that. And this is the time to just really take a serious look at what does your savings look like? Is this the best time to try to jump into a contract that's far away from home? So that, and then also I had a friend that sent me a really funny playlist. That was the COVID-19 playlist. And I'm going to share that link with you guys because I've actually been jamming out to it. It starts with Britney Spears' Toxic, and it just gets better and better. And it's made me laugh, and it's totally brightened my day. So I'm going to share that link with you guys so you guys can also jam out with me on COVID-19 Spotify playlist. And then I think that the best thing is like try to stay positive. I feel like this is all I think about because I'm building stuff to help everyone in our industry. But I try really hard to just watch the new or look at the new updates on the news once a day and then just turn it off and try to listen to upbeat music and try to listen to the podcasts that are positive versus just about this. As long as you guys are doing your social distancing, you're doing what you can to stop the spread so that the hospitals are not overwhelmed, it's okay to get into a new hobby and do the mental health stuff. I even just bought those little arrow garden things, if you guys have ever heard of them. Because I was like, what do I want to learn during this crazy time? And I want to learn how to garden, but I live in a tiny apartment. So I bought these little things that I could learn how to garden in my apartment, get some live plants around, something I would never do, except now I can't really go out and do much. So I'm just picking these little random things that bring me pieces of joy, learning a bit of a new hobby, because I want to look back on this time and think, cool, like it's over. It was scary, but I had a little bit of time where there was no FOMO. I have no fear of missing out. There's nothing going on outside. So what do I want to learn and do when I'm on my own? But mostly hang in there, guys, and I'll just keep showing up and trying to share with you guys what I see as trends going on. And then again, just please use the resources that I'm creating and stay in touch with me and Nomadicare and keep us in the loop of how we can help you guys more and more. If there's anything confusing or something you see going on, we really are just doubling down to try to work hard to make this easier for those of you that want to be on the front line. So please join the rapid response team. I'd be honored to have you a part of it. We have the interest form going out right now that you can sign up with, and then tomorrow the email will go out for the next steps, and you'll start seeing hundreds and hundreds more jobs on the Nomadicare job board for crisis rates. And then if you're a company that's interested in joining that, we've got some really amazing technology where you can just send over a CSV or just give us your XML feed. We can auto-generate pay packages for you. We can standardize your data. It's very little work for you, so we can get all of these jobs in one place. But thank you guys for joining, and I hope you all are taking care. Happy quarantine to each of you, and I'll see you guys next time on a update on the industry. All right. See you later.